paper that we have published so far is looking really at just the initial response to the vaccine. So we drew blood from people before they were vaccinated, after they got their first dose, and then after they got their second dose, so that we could monitor how they're responding. So we correlate that with age and other demographics, so we get a sense of who responds best and who might need additional boosts. And then we also compare people who have previously been infected versus people who are naive and have never seen the virus before. And we found interesting differences between these groups. So people who have never been infected by the virus and haven't had COVID-19, they really need both those doses of the Pfizer and Moderna vaccines to get an optimal response. Whereas the people who have been infected previously, they respond very strongly to that first dose of vaccine. Hi, my name is Dr. Susan U. Pritchard. I am a professor in the Department of Medicine here at Loyola University. I also have a co-appointment in the Department of Microbiology and Immunology. I'm also a co-director of Loyola's Infectious Disease and Immunology Research Institute. The project that we have going, looking at antibody response to the virus as well as the vaccines, includes both clinical and basic science collaborators. On the clinical side, we have Dr. Gail Reed and Nina Clark. They are MDs in the Division of Infectious Diseases in the Department of Medicine. And then on the basic side, there's myself, I'm a virologist, and also Susan Baker, who's in the Department of Microbiology Immunology. And she is a particularly important collaborator because she's one of these virologists who have actually been studying coronaviruses for many years. So the reason that we are interested in monitoring antibody response is it gives us a marker to follow how people are responding to the virus and to the vaccines. We want to know who's responding and how long that response is lasting. This is, for example, what tells us when do people need to start having boosters. And so our research is looking at people who have never been infected with the virus versus people who have previously experienced a SARS-CoV-2 infection, and determining how the immune response to the vaccine is different in those two populations. Typically, I'm studying hepatitis viruses, but of course, when the pandemic started, all virologists really came on board, right? There was a major public health issue. And so we have all done what we can to promote research on the SARS-CoV-2 virus. One of the things that has been incredibly valuable to our efforts is the Loyola Clinical Research Office Biorepository. It provides the staff necessary to set up clinics to draw the blood samples that we've been collecting, and then provides the technicians that process all of those blood samples. The nice thing about this particular project is we were able to get a small pilot grant from the Infectious Disease and Immunology Research Institute that allowed us to get some preliminary data, show that we had the biobank and all the capacity to collect those samples that are so important. And by generating that preliminary data, we were eventually able to get a second grant to fund us more completely. But these pilot grant fundings from the institutes, where that comes from is really from donors, people who believe in what we do and understand that sometimes we need a little help to get those extramural funding. And so there's other projects that, the Infectious Disease and Immunology Research Institute have funded, and we would like to do a lot more to potentiate research like this at Loyola.